My name is Kevin Gartz,
My name is Anissa, and who do you?
Sarah Gul Mohammadi.
and we'll be talking to you about diabetes type 1 today. I'm going to start off with saying what it is. Type 1 diabetes is previously known as juvenile diabetes. It's mainly diagnosed in children and young adults and only affects about 5 to 10% of our population. In this type of condition, your body does not produce enough insulin, and insulin is needed to take glucose from your blood cells, and that is what gives you energy. It transports it to the tissues in your body. It's a simple sugar that produces energy in your body, which allows you to move around throughout the day. There is also a genetic link to this type of diabetes. People with human leukocyte antigens are a carrier for this type of diabetes. These antigens are part of the immune system that when there is an infection in your body, they will kill the beta cells in your pancreas. The beta cells are what is responsible for producing the insulin. This diabetes usually affects people under 40 years of age. About 40% of these people who develop it are under 20. Male and females tend to be equal in the amount of people that have it. However, males do tend to get it more at early ages. Ethnicity also plays a minor role. It just depends on the person's diet and their genetics. According to Diapedia.org, which is a website that tells you about the statistics of diabetes, it tells us that type 1 diabetes has historically been more prevalent in European countries, but it is becoming more frequent in other ethnic groups. Europe has the highest rates of childhood diabetes, which is found in Scandinavia and Northwest Europe. Type 1 diabetes is more common in Norwegians than in Icelanders, while Finnish children have 3 times the risk compared with Estonians. India and China have relatively low incident rates, but they do account for a high proportion of the world's children with type 1 diabetes because of their large populations. Relevance to Houston Baptist University community. Diabetes type 1 mostly affects people in their young age, and here at Houston Baptist Universities, the main part of our population is 18 to 21 years of age, so it does have a tendency to affect our population here. There is no other evidence as to date on how it affects staff or faculty over here. Clinical manifestations. The onset of type 1 diabetes is usually rapid, so the signs and symptoms are usually acute. The classic symptoms are polyuria, which is excessive urination, polydipsia, which is excessive thirst, and polyphagia, which is excessive eating or hunger. Weight loss can also be a sign, as the body cannot get the glucose needed to get the energy it needs. This is followed by weakness and fatigue because of your lack of energy.
Okay, I'm going to talk about risk factor, complication, prevention, and diagnostic tests. The risk factor for diabetes are not numerous. The main sign that put people at risk for developing diabetes are genetics or family history. Having someone in your immediate family that has been diagnosed with diabetes make one more likely to be diagnosed themselves. There has also been a correlation between one's physical location and the likeliness of developing diabetes. Additionally, a correlation has been noted between a mother who had preeclampsia during pregnancy. While any individual is susceptible to being diagnosed with diabetes at any age, it is most commonly diagnosed for those between the age of 4 to 7 and 10 to 14. Diagnostic test. If the doctor suspects someone of having diabetes, they will order A1C test in order to check the average blood glucose level. This test checks the level of the glucose that has attached to the blood cells. This test checks the glycemic control over the past 2 to 3 months. This test is most common because it does not require the patient to fast before being tested. The goal is to have a result of less than 6.5%. There is also a fasting plasma glucose test. This test requires the patient to fast for 8 hours before the test. Result that find level equal to or higher than 126 milligram per deciliter indicates a positive finding for diabetes. Another test used is the 2 hours glucose tolerance test. Finding of over 200 milligram per deciliter indicate a positive result for diabetes. For this test, the patient is given 75 grams of glucose and then test their glucose level after 2 hours. A patient with increased urination, thirst, and unexpected weight loss, a glucose test will be given. Random glucose test will be given. Result of glucose level higher than 200 milligram per deciliter indicate diabetes. About complication of diabetes is characterized by hyperglycemia and dehydration. Additionally, those who do not properly monitor their personal glucose level may see other complications. This may include heart and blood vessel disease, nerve damage, kidney damage, or perhaps the loss of a limb. Another complication is ketoacidosis. This is caused by a large deficiency of insulin and it's characterized by hyperglycemia and dehydration. The sign and symptom are dry mucous membrane, breath smells sweet and fruity, increased heart rate, lethargy, nausea, and vomiting. Precipitating factors include illness, infection, and inadequate insulin dosage, and undiagnosed type 1 diabetes, and poor self-management. If the condition is not treated, it may result in death. Another complication of diabetes is hypoglycemia, which is a low blood glucose level. This happens when there is too much insulin compared to the glucose. This causes the glucose level to drop below 70 milligram per deciliter. Signs of this complication are shakiness, anxiety, paleness, difficulty speaking, confusion, and coma. This is caused by a mismatch of the timing of the peak action of the insulin and food intake. This may be onset by administrating too much insulin or ingesting too little food, delaying the time of eating, and performing an unusual amount of exercise. Diabetes is not a contagious disease. For prevention, the best way to avoid complications that are associated with type 1 diabetes are a strict monitoring regimen, regular exercise 5 times a week for 30 minutes, and using medication as needed and prescribed.
All individuals with type 1 diabetes require insulin. The 3 major types of glucose-lowering agents used in the treatment of diabetes are insulin, oral agents, and non-insulin injectable agents. People with type 1 diabetes require exogenous insulin to survive and may need multiple daily injections of insulin, often 4 or more, or continuous insulin infusion via an insulin pump to adequately control blood glucose levels. There are different types of insulin: rapid acting, short acting, and intermediate acting, and long acting. In addition to mealtime insulin, people with type 1 diabetes must also use a long or intermediate acting insulin to control blood glucose levels in between meals and overnight. Without this 24-hour background insulin, people with diabetes type 1 are more prone to developing diabetic ketoacidosis. For those who want to use only 1 or 2 injections per day, a short or rapid acting insulin is mixed with the intermediate acting insulin in the same syringe. This allows the patient to have both mealtime and basal coverage without having to administer 2 separate injections. Routine doses of insulin are usually administered subcutaneously. And there is also self-monitoring of blood glucose is a critical part of diabetes management. By providing a current blood glucose reading This enables the patient to make decisions regarding food intake, activity patterns, and medication dosages. Pancreas transplantation can be used in the treatment option for patients with type 1 diabetes, but usually this is done for patients who have end-stage kidney disease and have had or plan to have a kidney transplant. The goals of diabetes management are to reduce symptoms, promote well-being, prevent acute complications of hyperglycemia, and prevent or delay the onset progression of long-term complications. These goals are most likely to be met when the patient is able to maintain blood glucose levels as near to normal as possible. Diabetes is a chronic disease that requires daily decisions about food intake, blood glucose testing, medication, and exercise. Nutritional therapy and also self-monitoring of blood glucose are tools used in the management of diabetes. And so there is a financial burden to the patient and family and society. Because culture can have a strong influence on dietary preferences and meal preparations practices, culturally competent care has special relevance for the patient with diabetes, and the annual cost of diabetes exceeds $174 billion, with $116 billion in direct medical costs. And when it comes to complications, some families are deeply divided in decisions for their loved ones, and sometimes difficulties occur when money and property are also involved. And there are also emotional and spiritual effects of the disease. Patients with diabetes have high rates of depression, anxiety, and eating disorders. Depression contributes to poor adherence to diabetes self-care, feelings of helplessness related to chronic illness, and poor outcomes. Persons with type 1 diabetes have an increased risk of developing eating disorders. The greatest incidence of eating disorders is seen in females. Eating disorders include anorexia, bulimia, binge eating, excessive restriction of caloric intake, and intense exercise. The diagnosis of diabetes may cause feelings of anxiety and hopelessness and fear of rejection of family and friends. Patients may intentionally decrease their dose of insulin or omit the dose, which leads to weight loss, hyperglycemia, and glycosuria because the food ingested cannot be used for energy without adequate insulin. Serious consequences including retinopathy, neuropathy, lipid abnormalities, and diabetic ketoacidosis, and death. There are support resources for individuals and families. For example, there is the American Diabetes Association, which is a United States-based association working to fight the consequences of diabetes and to help those affected by diabetes. They provide information about healthy eating, lifestyle choices, and even information about healthcare providers. There is also a AADE, American Association of Diabetes Educators, which provides information for patients about managing their disease, drug teachings, and signs and symptoms of complications, which can also be used for family members. And there are no specific rehab centers, but there are many diabetic centers, such as the Joslin Diabetes Center, which offers information and support on diabetes management.
Thank you for joining us today, and I hope you learned a lot. Thank you.